and gentlemen, welcome to Global Health. This is your host, Dr. Yavuz Selim Sılay, co-founder and managing partner of AFROTURK TV, AFROTURK Agro TV, and soon coming AFROTURK Health TV. We're really excited for your amazing interest to our program. Today, I have one of the top key opinion leaders in diabetes. He is such an amazing leader with modesty, but at the same time, training so many trainers in diabetes, in heart failure, in hypertension, including utilizations in different religious practices, including Ramadan. And I am so honored to have him today. I'm so excited to host Professor Dr. Mehmet Akif Büyükbeşe. Welcome to AFROTURK TV Global Health Program.
It's a pleasure to be here. I'm very much impressed for your kind words and accepted as prayers. Thank you so much.
Thank you. You're one of our role models and one of our leaders in the medicine ecosystem. And, I know you very well. I've been following you for many years. You're an inspiration for many young as well as educated, trained doctors. But if you don't mind, for our viewers, more than 1 billion viewers across Africa, could you please tell a little bit about yourself? Who is Mehmet Akif Büyükbeşe? What excites you? What motivates you?
Well, I'm a consultant diabetologist. Actually, I'm graduated from Istanbul University, which was my first choice as a rank, a nationwide examination, as you know, in Turkey.
Yes. It's a very hard one. Yeah.
Yeah. And my only choice was medicine. I mean, I just fixed on it. And my kids the same. I mean, one of them, for example, was very keen on computer engineering, and he completed his education. And my daughter is on architecture, and she's just carrying on her education at the moment.
Amazing.
I didn't push them to be in any job or, in selection, but I just asked them, do you have passion? Do you like it? Are you ready to struggle with? Because if you have a passion, then any of the struggle will be easier for you to overcome. Let me start with my grandparents.
Please.
Education actually very important. And it starts, today we call it preschooling. But in our time, it was grandfathers and grandmothers. My father's father actually gave me the name.
Amazing.
My first name and the second name, because he was very keen on, our very famous poet, whose name is Mehmet Akif Ersoy. He was a very religious person during the time of Independence War, after demolition of Ottoman Empire, before the establishment of Republic of Turkey today. And, and we followed him very much, because in those days there was no internet and some other facilities to reach out to knowledge. And we were very much, keen on to seek for role model people. It may be your father, grandfather, your aunt, your neighbor, or elsewhere somewhere. Whoever he or she is, that was very important. And I think my father's father, my grandfather, was, very focusing on something. And, he has a passion. And I was gathering and absorbing what he is, rather than saying what we were absorbing at that time when we were acting as a grandchild. And I want to mention also my mother's mother at this time. I can say she was not an activist, but she was acting as if, working for the human rights, for example.
Amazing.
But
Amazing.
those things, I guess, pushed me to jump into medicine, where focusing is important, human rights are important, love of humankind is important.
Indeed.
And going deep in details of the knowledge. So that, also pushes me to be an academician rather than, doing something else as a doctor. And later on, I decided to become an internal physician because, in Turkey, graduation is 6 years.
Yes.
And in third year, most of the time, medicine is, I'm not underestimating, Nelson's textbook is,
Huge.
huge. uh, more than Harrison, what we have today for internal medicine. I respect the pediatricians, but it's still I can say if there's an opening ceremony for medicine, it is internal medicine.
It is indeed.
So, right.
Then why did you choose internal medicine? And also, I know you're one of the top leaders in diabetes. Why did you focus on diabetes also?
Yeah, your kind words. Yeah, I was just about to come over this topic actually. When I was at the third year of my training as a medical faculty student, you have rotations. Internal medicine rotation.
Sure.
I have who is the chief of the residence. He's now a professor and nephrologist. I saw something different in him while comparing other disciplines. He was trying to bring not only clinical science but also gathering knowledge and some other deep insights from the basic science. So you're not fulfilling yourself with touching the patient, listening to them with empathy and tolerance maybe, but also trying to understand deeply what's going wrong, such as why not all headaches are the same or something like that. Professor Ayhan is very important for me to jump into internal medicine. And after graduating from medical school, a nationwide doctor examination then comes to the region, and I only chose internal medicine, and Jarapuri School of Medicine was the first SRO, in the rank, I can say. Um, there, there, you know, i- in Turkey, you have to have thesis.
Sure.
And luckily, I had Professor Hüsam Hatemi, who is one of the top leaders of diabetes. Is from when you look at diabetes in history, insulin is actually developed in 1921 something, and there was the really lack of biochemistry, lack of instruments to check what's going on with only urine sample, which really does not reflect uh, the blood glucose level at the same time and so forth. But his relationship with the patients, yeah, management style for the chronic disease such as diabetes, which is very common all around the world, but also Turkey is one of the leading countries and more than average in the globe, I can say. So Hüsam Hatemi, I guess, affected me. But later on, I said, this is not enough. I finished the residency, but I'm not satisfied. There are lots to be learned. They open lots of kind of windows on the internet, in another word, I can say. So I decided to become an academician.
Amazing.
Yeah.
And by the way, both Hüsrev Hatemi and Hüseyin Hatemi are good friends of my father, who is also a physician, and he's also a graduate of Cerrahpaşa. So that explains, and they were also inspirations for him as well. So this is very interesting what you're saying. Clearly, one person can make huge difference, Dr. Akif, in people's life. If it's forming your career, if it's giving you a role model. Now, you took him as a role model, and now you are a role model for many diabetologists, many internal medicine people are following your footsteps. So it gives that responsibility. And why diabetes specifically? I see you engaging in diabetes a lot as well. Is that correct?
Yes, that's correct. Yeah. Well, because it's a chronic disease, and following the patients and learning from them. I mean, if you follow them, actually, you start reading them, because every humankind is a piece, but from the universe, and that piece is also a universe. And diabetes is a very good example, because not only the story of blood glucose affecting many, many areas, their blood is transferred from your heart to the tip of your toe. So every part and every piece of your body is actually affected. So it's not boring. I mean, it is. I'm not saying that it is always lovable, but because you are facing with difficulties, complications, and so forth. And some people are very much miserable, but understanding them, helping them at least to deal with the complications are really much satisfying, I can say.
And as a global diabetes expert, which areas do you focus on and which diseases specifically you are treating? If you can count with like top 5 areas that you kind of either more frequently coming to you or you enjoy treating or
Okay.
preventing.
Yeah, yeah, it's a big issue. I mean, every part is very important actually because we need people. I mean, let's say some guy is very much keen on, like in Manchester University, there is a guy who is very famous on diabetic food, and he's writing, and we are very excited to reading and learning from him, and something like that, and lots of things. But I discovered that especially the burden of diabetes increasing everywhere, including Africa. Um,
Indeed.
no, I think we do not have enough time to talk to all people with diabetes. So time constraint is really much striking thing today. So I focus, one of my things that I do is educating diabetes people, not just prescribing this is it and sending the patient home, but also sparing time. If there's no time, then I'm letting them have appointment and letting them to be part of the classroom. This is diabetes education classroom. It is one thing. The other thing is that many of our people are type 2 diabetes, and they are on pill therapy, or oral therapy. But when diabetes progresses, pills are not enough. Then you would need to combine that with injection therapy, starting with insulin, for example, at least long acting ones today. But there is a insulin barrier, use of insulin barrier, because it seems not that much sweet to start with injection therapy, which is lifelong therapy. And so again, the education is very important. This conversion from pills to insulin also attracts my attention, where we had time to study with Turkish Diabetes Foundation in order to understand what's going on, in order to get rid of the complications, of course.
Indeed. As a global leader, you work with American Diabetes Association, Turkish, British. As a global leader, when I see what you're treating and the disease you're focusing on, what fascinates me, you provide individual training and, teaching patients how to take care of themselves. You also do it in group settings for patients, but more importantly, you are having a huge impact, Dr. Akif, through training the physicians. When you look at Africa from this point, let's dive into Africa. What are the chronic diseases that really impacts Africa from your analysis? As a global traveler, you traveled all around the globe and you have many patients. Even in Turkey, there are more than 600,000 African students now in the universities. Whether in your practice in Turkey, if you have treated African patients, or in other areas, or even African American, or there are many. They say humanity comes from Africa. So, but at the end, what is your analysis on the chronic diseases currently in Africa?
Yeah, these people are actually our brothers and sisters, and I always have, almost all my lifetime, have a couple of African descent people in my list on my cell phone.
Amazing.
It started actually when I discovered an African medical student at Marmara University in Istanbul. If he's watching us by chance, I will be very happy. He was very honest, handsome, tall, religious, and trustable person.
Amazing.
And later on, when he graduated, he moved to United Kingdom. Hopefully, I'm going to meet with him again. He was originally from West Africa, Ghana, actually.
And we have many viewers from Ghana and Nigeria and as well from the West Africa.
Yeah. Eh, well, African people have, a little bit different, skeletal system,
Sure.
which makes them the champion of the Olympics.
Yes.
But apart from that, when we look at, regardless of the obesity, diabetes is common and increasing. The increasing rate is more as a comparison to European population, for example.
Oh, really?
Yeah. When we started with diabetes and Ramadan, especially in the MENA region, which is Middle East and North Africa, as you know, and when you look at the International Diabetes Federation Diabetes Atlas, the more population with diabetes is seen in this area. So MENA is a very striking place for many of the diabetologists all around the world. As a chronic disease, diabetes is not the sugar disease, actually. Apart from that, there's hypertension, there's high cholesterol, there's obesity, there's insulin resistance, risk of cardiovascular disease, and so forth.
I see.
And for those who are addicted to smoking is another challenging. Then in Africa, of course, one other thing is the hypertension, I may say, which starts earlier at age. And that's very important because as you put the diagnosis earlier, this is not only providing you to get rid of the complications, but also make the solution and because hypertension itself is a risk factor for diabetes as well. Sometimes hypertension starts earlier and then the diabetes develops, and sometimes diabetes starts earlier and later in life. And both of them are also risk factor for the development of kidney disease.
I see. And in terms of the chronic diseases that are important for Africa, I'm inviting, there are many health ministers which are in touch with us, inviting them to really utilize Professor Dr. Mehmet Akif Büyükbeşe in their design of their systems, look into especially chronic disease. And I think in future episodes, we're going to talk dive into some other areas, including diabetes. But for this episode, can I get your final messages for our beautiful viewers from Africa, Dr. Akif?
Well, I love Africa. Number one. Number two, I am living in a place in the southeast border of the country, which is like the Syria border, the city named Gaziantep, which is very famous with baklava. Well, the city itself is a diabetes land, I have to say. I also know as the baklava land since from the Ottoman Empire. It's that much. And I haven't seen any person in any country whom I invited to Gaziantep came and taste baklava and make any hesitation. So come and enjoy. We are the gastronomy city, number one. And number two, I want to visit one day Africa again because I miss those people, those kind people. I miss it.
Hopefully, we'll do it together. You never know. And thank you very much for hosting and being in this amazing episode. And ladies and gentlemen, there will be more that we will talk with our amazing key opinion leader, Professor Dr. Mehmet Akif Büyükbeşe, especially his work on diabetes will be an episode in the future. We will also, because of your huge interest, will enter and discuss some other issues around hypertension and as well as chronic heart disease. And also, he recently has organized a very important conference. In our future episodes, we will also talk about diabetes and Ramadan for those who are fasting, whether you're a Muslim or non-Muslim. If you're doing different types of fasting as a Muslim, Christian, or Jew, doesn't matter, or just for health reasons, you need to understand how fasting impacts your diabetes if you're a diabetic patient, how it helps, improves, or what are the preparations you need to do. So stay tuned to AFROTURK TV with Global Health. And in our future episodes, as I promised you, I'm bringing people from all walks of life, and Professor Dr. Mehmet Akif Büyükbeşe will be with us in future episodes. This is Dr. Yavuz Selim Sılay. Take care and all the best. Bye.